On this episode of Putting Possibility into Practice, we're talking about energy practice analytics. We will get two very different perspectives, one from the practice standpoint and one from a provider standpoint, on how practice analytics have helped a couple of our customers, plus learn how practice analytics assisted our customers in achieving patient-centered medical home status, plus how it integrates with your energy platform. This is Putting Possibility into Practice, and it starts right now. I'm Joe Augustinelli, Social Media Manager at Greenway Health, and welcome to this episode of our podcast, Putting Possibility into Practice. If this is the first time that you're tuning in, we're glad you have found us on your platform of choice. If you have not already, after finding us, we do invite you to subscribe to our podcast. That way you receive notifications every time that new episodes are published each week. And if you're a returning listener, we thank you once again for tuning in to another episode. On this episode, I am joined by Dr. Mike Jordan of East Lake Pediatrics and also Isabel Rodriguez of Treasure Coast Community Health. We are going to be talking about practice analytics and how providers can use analytics in their practice, and we thought it would be great if we can have a couple of different perspectives on how analytics work throughout an organization. And so we are getting the provider's perspective from Dr. Jordan, who you'll hear from in a little bit, and also from the practice side, and that's where we will bring in Isabel Rodriguez from Treasure Coast Community Health. I want to thank you both for being on this episode of Putting Possibility into Practice.
Treasure Coast Community Health is located in the Treasure Coast area in Indian River County. We have about 6 facilities. We're a patient-centered medical home, so what that means is that we have several services at every location. We have pediatric, family practice, GYN. We also have x-rays and labs. We have expanded. We do have a new location that we just recently opened that focuses more on adult population and behavioral health for the moment. And we provide a lot of services for the community.
And then on the provider side, we welcome back to our podcast Dr. Mike Jordan. And for those who may not be familiar, Dr. Jordan, talk a little bit about your practice, where you're concentrated, located, and all that stuff. And you, I think, also recently or are in the midst of, last time we talked, an expansion, correct?
Yeah, that's right. We're expanding our Trinity location, and that is just about buttoned up now. So we're getting ready to start seeing patients there any day now. But my name is Mike Jordan. I'm a pediatrician, and we have a practice called East Lake Pediatrics. It's in Palm Harbor and Trinity, Florida, which is in like North Pinellas and South Pasco County. We started in like 2004 with Entergy and have been a customer ever since.
And as we discuss Energy's practice analytics, first, Isabel, your thought on the analytics platform and how do you use it on a daily basis for your position?
For my position, because I'm an electronic health records trainer, I go back with the providers to let them know how they're doing with their documentation versus on quality measures or just tracking a certain condition. The PA is really easy to use, and when in doubt, Greenway is always there to help with customer service in case we have a doubt on the report. But it's really easy to manage and pull certain conditions and then give feedback to the providers on this is how you're doing, this is how your documentation is going.
And from the provider side, Dr. Jordan, your thoughts on energy practice analytics and how do you use it on a daily basis that may differ from how Isabel was just talking about it?
Well, we use practice analytics. Initially, we were using it mainly for meaningful use, and then we went through patient-centered medical home qualification in 2017. So that was integral as far as enabling us to meet the reporting measures that are required to jump through those hoops. And so on a daily basis, we use it, with reports that we have set up for either daily, weekly, or monthly automation. So we get those reports on or I'll get them in my email whenever they're run. And it's very helpful to be able to set up some metrics that you want to monitor and to kind of automate it and then set it and not have to worry about it. And then when the time comes for you to evaluate them, it's in your inbox, you're ready to look at it, and it makes life a lot easier. And actually the reports get done. Otherwise, if I had to do it myself, be on the procrastination pile.
Yes.
Does that pile get bigger and bigger as the week goes on?
I'm looking to set the record.
And you brought up a point, Dr. Jordan, that I'd like to just discuss a little further. So in 2017, you said you went through the PCMH certification program. So for a practice who maybe is looking to go through that or is in the process of going through it, how does analytics really assist with that process from what you can recall?
Well, it was, like I said, I couldn't have done it without it. In fact, they had it might have been a 160 or 200 page kind of PDF file that I used, that was just kind of step by step showed me how to run each report based on the metrics for each little chapter that you had to go through. And, there was some reports that aren't necessarily available in practice analytics, but the program is kind of robust enough that you can then write the reports, and it does, it takes a little bit of kind of getting used to it, but once you learn how to do it, it certainly is something that most people can kind of get a hold of and make use of getting some basic reports done. And if you ever run into issues, customer support is there, and I've made lots of friends throughout the country that use the software, and I can call my buddy Mike up, and he can always help me out up over at up in Oregon at Northwest Primary Care. He's an excellent user of practice analytics and always hooks me up with some help if I have any questions.
And Isabel, when we talk about the PCMH certification, is that something that Treasure Coast Community Health has gone through that you're aware of, and how did it work out for you utilizing analytics?
Yes, we actually have been under the PCMH for a while now, and it's really great because the practice analytics helps pinpoint those reports, and like the provider said, it's easy to use. So you can create your own reports, you can kind of filter out what you want, what you do not need, and because it's easy to use, other departments throughout TCCH will call me to help them with some of their reporting, whether it's the billing department or just for reports for UDS.
And two very different perspectives here on this. So I'll ask Isabel, ask you as the trainer, and then we'll ask Dr. Mike as the provider. But as a trainer, as if I was starting to work at the practice as a provider or a member of the practice staff, how do you find analytics? Bringing somebody on board and showing them the ins and outs of the software. How is it easy to get somebody up to speed who may not be familiar with the software?
In using the PA software, or just understanding the reporting?
Both. Yep.
Both. Okay. It's easy to manage, especially because of the layout of the software. It pretty much tells you what are you looking for. You can set standards or certain wording on what you're looking for, whether it's an insurance or whether it's just a care condition or a certain type of patients that belong to a care program. So it's easy to explain it to someone, but you have to actually show them and have them, put their hands in there and play around with it so that they understand it, because people learn different ways. And so that's kind of how I go about it.
And Mike, on the provider side, how have you found analytics from a provider's perspective, using it on a daily basis and with everything else you got to do and take care of on a daily basis?
Yeah, I found it very helpful to obviously go through the training when we first got the software, and then and just as luck would have it, as I was finishing that training, it was time for an Engage, and they had a pre-conference workshop that kind of did another deep dive into practice analytics, and that was very helpful, kind of solidified what I had learned in the training, and then gave me some ideas and examples of how to kind of move things around and do things when I was back at home. And then it's just a matter of kind of looking for the reports, not being afraid to kind of punch buttons and click on reports and see what you can generate. But I thought it was pretty intuitive as far as how to utilize it, how to enter the data in. There's some quirks about how to set parameters and things like that. But for what I need to run, and I'm not necessarily a PA expert, I can get by with getting some basic reporting done and writing some basic reports. It seems it's very useful for the practice.
And I'll get both of you guys' perspective on this too before we wrap up. But advice for a practice who may be considering, going with the practice analytics. What would you tell that person if they were looking at that to add on to their practice?
I honestly think that it's a good idea, especially for integrated care, because you can make a report, or you can put different types of practices in one report or split it up. And I think that understanding the PA part of it also helps the providers understand how important their documentation is. So I really do think that I would help or would tell someone that Greenway is a good system to use for integrated care.
And Dr. Jordan, I'll ask you the same question as a provider, using practice analytics. If there was another provider, whether it was a pediatrician or where you say, from a provider's perspective, I thought it was great you talked about, conferring with Northwest
Sure.
Primary care. As a provider, how does it help with, having software, or if a different provider was looking for analytics, what would you let them know?
Well, the whole point, of all this data entry is to be able to analyze it. And if you don't have a software tool to do that, then, you can't really utilize what the data you're entering, And so being able to have a program that allows you to, track trends, it shows performance. You can kind of measure certain standards versus the other providers in your practice versus the other offices in your practice, and being able to kind of parse all that out and look at it and twist it and, just manipulate it, massage the data. You can really glean some important information. And for me as a business owner, it helps me guide what my next step is going to be, or where are there some shortcomings that we need to shore up. All of those things are really kind of become readily apparent when you utilize the software and maximize its capability.
And I want to thank both my guests for appearing on this episode of Putting Possibility into Practice. A reminder to learn more about practice analytics and about Greenway's other product solutions that can help fuel your success and the success of your practice. Please visit our website at www.greenwayhealth.com. And as I mentioned earlier, we always invite you to subscribe to our podcast. You can do it on your favorite platform of choice. We're on a number of the podcast platforms now, which includes iTunes, Google Podcasts, Stitcher, FM.Player, on iTunes Radio, TuneIn Radio, SoundCloud, Spotify, and Libsyn. I'm Joe Augustinelli, the social media manager at Greenway Health, and this has been another episode of our podcast, Putting Possibility into Practice. Thanks for listening.